все своє мушу з собою.
It's August 2, Ukraine Media Center Ukraine Forum continues its operation. My name is Svetlana Chaporenko. Now we will be having our next briefing topic, the mobile health brigades of Ukrainian Red Cross, digital technologies in primary healthcare. I want to introduce our guest today. It's Mykola Polishchuk, president of the Ukrainian Red Cross Society, Minister of Health of Ukraine in 2005. Alexander Bobenko, head of the healthcare department of the Red Cross Society of Ukraine, Stanislav Bordin, coordinator of the mobile health units Ukrainian Red Cross Society, and Anton Sak, chief specialist of the mobile health units of the Red Cross of Ukraine, and Yuri Kovalenko, cardiologist. Before we proceed to our conversation and discussion of this topic, I offer you to see a small video. Poltava region. Today 160 per 80. Well, generally it's only the beginning. Have you taken your medicines? The project was implemented in the Poltava region. It's a remote village. Local citizens and internally displaced persons find it difficult to get to the medical institutions. They can get advice from the doctor here. They can undergo tests here, get diagnosed. And currently Poltava region is fulfilling a pilot project. We're implementing the component of telemedicine. All of our teams are equipped with such devices as telecard, UCard, and if a doctor sees that there are problems like cardiovascular, there's a cardiogram taken and it's already sent using those devices to the cardiovascular center of Poltava. Before the visits of the Red Cross, the teams of the Red Cross, they were already on schedule. People know, people expect for them. They come to be examined by doctors to get some medical aid. I'm very grateful for that service. We have 118 such teams working in Ukraine. The majority of mobile health units work as the emergency units, but we can and we plan to continue such projects within which we could provide the diagnostic component for everybody. Mr. Mykola, mobile health units work in Ukraine for 1 year already. So how have you come up with this project and how had the need for them emerged? Can you please pick up the microphone? Well, mobile health units have been working in Ukraine practically since the beginning of the ATO, and they were working in the east of Ukraine. And today, when the full-scale war has erupted, we have 118 mobile health units, and the director will tell you, the director of medical department will tell you in detail about that. But what I want to mention is that the mobile health units, their functions are working as the first link. Why as the first link? Investment in the high-tech medical aid will not reduce the rate of illnesses and the quality of life. They can only improve the health of certain category of population. The medics are interested in having more people ill. That's absolutely normal motivation. The more they work, the more money they make. Moreover, when the National Health Service of Ukraine pays for the work done, I don't want to say work done on a high quality level, because there can be no low quality in medicine. If someone works with the low quality, they should have their diploma or certificate revoked and let them sweep the streets then. And in this sense, we work in projects that are proposed to us by our foreign colleagues. In Europe, in the European Union, 64 to 70% of doctors are the common practitioners. In our case is different. We are building some centers, we install equipment, as expensive as it not always comes in Europe, and thus we show how intense is our work. The more centers we build, the more work the medics will have. The less common practitioners will have, the more people will get ill. And those projects that we implement, and we implement them not because we want to do so, but we implement them in compliance with the orders of our donors. For example, German Red Cross, International Federation of Red Cross, Austrian Red Cross, Japanese, Norwegian, Italian Red Cross, Canadian Red Cross, Danish Red Cross, Austrian Red Cross. They fund and maintain certain number of mobile health units. Our task is to develop the program in a way that it works as a first link. And here we have certain complications. However, we have achievements too, because every single country has their own vision of the first link. And we are forced to adapt it to our conditions. Moreover, they are the conditions of war, when major fraction, or not certain fraction of population has left, and those who stay in the country are of old age, and given the absence of high quality diagnostics, and in certain cases the absence of opportunity for the people to get medicines. My colleagues will cover all those issues in detail maybe, and I will summarize it later, because to see how the mobile health units work, we have to go there on spot. We were almost at every site of every single mobile health unit, and we also engage the volunteers who want to help us in one matter or another, specifically when we arrange the telemedicine, the digitalization, when a person can be diagnosed remotely and then they are treated as a patient. I would like to ask the director of department, Mr. Alexander Babenko, and then his colleagues, and our volunteer, Mr. Kovalenko. We will briefly stop at those questions. Mr. Alexander, can you please tell us about the results of the work of the medical brigades or the mobile health units, and what are the problems solved by them? Good afternoon. The idea of creation of mobile health units was implemented in 2015 with the support of the World Health Organization. And since then, the mobile health units were significantly improved, and now they are an active support for the family doctors in the remote regions and villages and towns that were affected by the war, where the citizens of the communities are mostly affected by the war, and are in need of medical help, because the emergency medical aid, as Mr. Mykola said, is a component of medicine which further on formulates the further fate of the patient, and the timely address to the specialist depends on it, as well as efficiency of treatment. The Red Cross Society in Ukraine works shoulder to shoulder with the Centers for Primary Medical Aid, ensuring the mobility, technical quality, and emergency response to the medical aid needs. Thanks to the stable support of the societies of the Red Cross from many countries, the mobile health units work in 22 regions, more than 100 districts and territorial communities. More than 1,500 patients have access to the doctors in the examinations sites of the Red Cross. The Red Cross Society, on our part, we try to improve the logistics support of the first link, but also to assist the application of the up-to-date technologies, such as the telemedical diagnostic examinations in pilot format. In Poltava region, the mobile teams have portable electrocardiograph devices capable of transferring the medical protocols, and the doctor, as a part of the brigade, can not only fulfill the electrocardiographic diagnostic of cardiovascular activity of the patient, but also take advice from the cardiologist live, and that cardiologist can decipher the cardiograph and provide necessary advice to the patients. Sometimes the patients may even need to be hospitalized given certain medical conditions. Now I would like to give the floor to Mr. Stanislav Borodin, so he tells us in detail what are the mobile health units of the Red Cross of Ukraine. Mr. Stanislav, can you please tell us what is the way of operation of the medical health units on sites, and what are the problems people are coming to you with? Good afternoon. As it was said, we have 118 mobile health units working in Ukraine in 22 regions, with the exclusion of temporarily occupied Lugansk region, Autonomous Republic of Crimea, and occupied parts of Kherson region. What is a mobile health unit? It's a vehicle, like an ambulance truck. Sometimes it's a regular crossover truck, and on board that vehicle there is a driver, family doctor, and 2 nurses. That's the standard. But sometimes we have differently formatted teams, like so sometimes there is a pediatrist or psychologist replacing one of the nurses. Mobile health units work 5 days a week. They set out on missions for a daily basis, depending on the workload of the family doctors they have at their medical facilities or healthcare facilities. And we visit some remote villages, sometimes very small villages where people either have a limited access or no access at all to the healthcare facilities or even pharmacies. There are different reasons for that. There is first of all, it's the fact that some of the doctors have left the countries, or they moved to the western parts, or sometimes the infrastructure was so badly damaged that the healthcare facilities shut down, as well as pharmacies, and people don't have access to the medicines. Our mobile health units visit such villages. We bring the minimum of diagnostic equipment. We may check the level of sugar in the blood, saturation of the blood, body temperature, arterial pressure. and provide the patient or the beneficiaries with a certain set of medicines for 3 or 5 days to cope with the crisis this or that patient was facing. If during our visit the family doctor finds out that a patient is in a near critical condition, then our doctor forwards or links that patient. If they need additional examination, they recommend to address the specialist to get examined, get the plan of treatment, and undergo such treatment. But we had cases, not so numerous, but still we had them, when during our visit a person was starting to feel unwell, or their health condition was becoming of concern to our family doctors, and our family doctors were calling to the ambulance who or emergency response team, who were providing necessary aid to stabilize their condition or to hospitalize such person. Well, I can list such cases with the fingers of one of my hands, but we had such cases indeed. Sometimes our mobile health brigade are involved in evacuation of the people. For example, we were addressed by our colleagues in Kherson and Sumy regions to support them to come to the railway station and to support them in evacuation of people who were evacuated from dangerous regions, to help them in transportation to their compact residence sites. We react the soonest possible and to the most efficient possible to the challenges like that. Thank you. Thank you, Mr. Anton. How do you pick personnel for the medical teams? What are the requirements to those persons working with you? Thank you. Thank you for your question. It's a kind of an unexpected question for me, but I can answer it. In fact, the picking of personnel and their in work with the mobile health units is exercised by the healthcare facilities that are recognized as such, as those compliant with the criteria for admission to the mobile health units in those regions, and they are mostly the management of the healthcare facilities who identifies the specialists who will become a part of the mobile health units, which is not bad, because mostly the medical services are being controlled on sites. The same thing happens to the drivers and the nurses. So to say, all of the authorities are delegated to the management of healthcare facilities. I also wanted to add a couple of words to what Stanislav said about the involvement of our mobile health units. During the man-made catastrophe in Kherson region, our mobile teams on a rotation basis and voluntarily, I mean, all the specialists who were coming to Kherson region, it was their goodwill to become a part of a team, and the rotation was from 7 to 10 days, and thus the mobile health units could reinforce the first link of the primary link of the emergency support. Well, emergency response units were doing their thing, the state emergency service were doing their thing. So my message was quite brief. So my message was about the principal task that mobile health units are oriented for, because adding to what Stanislav said, mobile health units also remove the huge workload from the primary link of the healthcare, because there was a significant number of internally displaced persons who were moved to different regions of Ukraine, which resulted in the huge workload for the healthcare facilities. Even if they preserved their personnel, but due to the growth of demand for medical health care, the mobile health units have undertaken this responsibility to remove the part of the workload from them. When the government was building capacity for centralized medical health care for the internally displaced persons, and if we talk about the small villages, they were just vacant houses where people were put in. They were put there on a regional level, and our teams were getting information about where those people were billeted. We added that information to our routes. We started building capacity that are called the compact residence sites of the internally displaced persons. The mobile health units added those places to their routes too. And thus the coverage of internally displaced persons increased almost twice. Now it's about 40,000 services provided to internally displaced persons. So that was my brief message about that part of work. Thank you. I want to add to something Anton has said in response to a question about picking personnel for mobile health units. I want to emphasize it that unlike some famous formats internationally known, our format is completely tied to the policy of the primary medical healthcare link. So we don't do anything in contrary to the personnel policy and in contrary to the policy of work priorities. So all the personnel matters are solved by the centers of primary health care, and we only reinforce their work. We build our capacities into the structure of existing healthcare system. I don't criticize other approaches existing throughout the world, but we are the supporters of the state healthcare system. That's one thing. And another thing, that no one should see the mobile health units as a type of service existing anywhere, because one may have an impression that you come to a village council and you see a Red Cross doctor there, but it's not so. The mobile health units work where they are needed most, and tomorrow they may need on a different side. Those priorities are set by the regional healthcare organizations. We cannot cover all the territory. We are only where we are needed the most, where there is a need to reinforce the work. So one should treat this service properly. It's not available in all the cities and villages of Ukraine, but only where it's needed the most, and the family doctors along with the healthcare facilities, they know about it. So you can get information about that at every specific situation. Thank you. Mr. Yuri, let me add a couple of words. I would like to emphasize again what my colleagues have just said. Today we're only talking about mobile health units. The activity of the Red Cross Society is way broader. It includes mobile health units, module buildings, shelters, heat, hygienic products, evacuation, financial support, payment of the utility services for internally displaced individuals. We have a very broad range of services, but mobile health units is the aspect we wanted to cover today. Generally, the Red Cross Society of Ukraine have supported more than 12 million people. More than 12 million people received some aid from Red Cross. On a daily basis, about 1,500 persons are served by mobile health units. One may say or ask why there are more teams in one region than in other one, but there is practically no region in Ukraine where the internally displaced persons would account for less than 10% of the existing population. And in the Carpathia region, there is 1,200,000 to 1,350,000. So it's about 30 to 40% of the population of the region. And obviously the family doctors can't cope with such an intense flow of patients. And this is where we are needed the most. And what the head of the regional organization in Poltava region mentioned, we try to be on time, and we try telemedicine or so-called digitalization that back in 2003 we established with Mr. Kovalenko in Communist Podilsk for the first time in Ukraine. So we don't pick a team when we go to see the way they work. We're just asking where is the closest brigade. We see them in the field, and here you were able to see one of the villages in Piratin district of Poltava region. So what's the essence? We've engaged my colleagues as volunteers with the portable X-ray machines, and Mr. Yuri can tell you more detail about that. And what we've examined, what we find out, you're about to hear shortly. As well, telecard was implemented in Ukraine in 2003-2004. Until now, it's not functioning yet. Yes, my colleague said that those are the single cases, but among 15 people who were examined with electrocardiographic device, 30% were hospitalized immediately. They had a stroke, they had a heart attack. Well, it's not such a huge number of people, 4 or 5 people out of 12 or 13, but it's 15% or 30%. So when I've asked in Dnipropetrovsk region, in Magdalenivka district, we were visiting a family doctor with Mr. Alexander there. Can you please tell us what is the number of people who are affected by high blood pressure? Well, I cannot tell you for sure, he said, but about 70% have hypertension. So, and I am asking, what is the number of people who are hearing for the first time? Well, 69% of the population, of those people, they said they were hearing about their hypertension for the first time after 2 years of COVID. We're not talking about internally displaced persons here. And here I'm asking, what is the number of people getting hypertensive medicines on a regular basis? And they said nobody. So my colleagues have said our task is to identify, to provide a reserve of medicines for 3 to 5 days for free of charge, and then there is a basic set of medicines who are supposed to be reimbursed. So we work with the local communities, with their regional and municipal councils on site. We don't submit to the Ministry of Health. We only work with communities. And there was an interesting experiment. We've implemented the so-called telemedicine, well, not so-called, but telemedicine in one of the villages, and we plan to continue to implement such projects. We want to screen the village population and internally displaced persons to find out any pathologies that are of threat to life. And I would like to ask Mr. Yuri Kovalenko to give more detail about that. Thank you. Well, first of all, I want to thank for invitation to this press conference, because it's important to communicate that today the up-to-date technologies have increased capabilities to support the health of the population. The mobile health units are supposed to make the medical aid efficient, but to make it efficient, we have to improve the efficiency of diagnostics. I've come with the guide for the doctors who link the patients to X-ray test. So 80% of the diagnosis use the X-ray diagnostics or ultrasonic diagnostics. You open any page of this guide and you see that ultrasonic examination or X-ray examination is very widespread. At the same time, in Ukraine, X-ray diagnostics is not accessible for the major part of the population, because the X-rays machines are concentrated in the X-ray departments of the healthcare facilities, and with the population of 40 million, you cannot visit 2,000 healthcare facilities. So to improve the efficiency of X-ray diagnostic, it should become a primary link. When a patient comes to a doctor is supposed to be able to make an X-ray shot, and the X-ray examination and ultrasonic examination can be done by properly trained family doctors or even paramedics, as it's done abroad. So to make an chest X-ray is no more difficult than making electrocardiography. So when we were coming to Piratin district, the specialists of the Red Cross have seen that it's really so, and training an operator to fulfill the protocols of ultrasonic diagnostics and X-ray of a chest, for example, can be done within 2 weeks. And in Ukraine, such operators are already being trained. There is a training course for X-ray systems, for the operators of the X-ray systems in Ivano-Frankivsk region. They train nurses or people with a specialized medical education. So the study we've done in Piratinsk district resulted in identification of hypertension and other diseases. Fortunately, we've never identified, say, lung cancer or tuberculosis, but we were also visiting Borodavka in Kiev region, where we identified something in some people. So we identified pathologies in 10% of the patients. There was also an ultrasonic diagnostic specialist who was diagnosing the arteries and diagnosing the liver with ultrasonic devices. And we identified that only 10% of the population can be considered completely healthy. So the more we examine them, the more we understand that significant fraction of our population are having some kind of illnesses. So when we were examining the knee joints in 15 patients, and we've identified arthrosis in all of those people. So people have come to us with complaints, and all of them had arthrosis in their knees. So the availability of X-ray devices, ultrasonic scanners with them to the mobile health units increases their capabilities substantially. This year, the Ukrainian Association of the Radiologists and Ultrasonic Specialists addressed the Ministry of Health with the proposal to implement the primary X-ray diagnostic based on the principle based on the POCUS principle. And X-ray diagnostics, POC X-ray, point of contact ultrasound, and implement the X-ray diagnostics at the point of contact. Ukraine has these capabilities. The relevant equipment, X-ray and ultrasonic equipment, is being manufactured in Ukraine. There are specialists trained, and everything that we need is a goodwill. So if the mobile health units are equipped with the ultrasonic scanners and portable X-ray devices, obviously their capabilities will be increased significantly. When the COVID-19 epidemics have erupted, American College of X-ray Medicine asked whether the X-ray diagnostics is efficient for COVID diagnostics, and they responded yes. If digital X-ray is done in the primary healthcare facilities with the portable X-ray devices. So they were not talking about sensitivity, they were talking about efficiency, because 40, 60 or 80% of the patients, they can already be diagnosed and they don't go anywhere else and they don't infect other people. They start getting treatment right away. Now, for example, in tuberculosis in Ukraine, it says that only the X-ray diagnostics satisfies the needs to identify the proper diagnosis of tuberculosis. You know that recently adopted document, the law on countering tuberculosis, we have to know about it, and we should be capable of diagnosing this type of disease on an early stage. Thank you. You know, a specialist is always a specialist. They tell you everything in such profound detail that I want people to understand it. You know, today we had a digital X-ray examination in Pariatan region. The X-ray graphs were deciphered by a doctor in Mukachevo, and he said right away how many suspicions he have. Those patients should be additionally examined by the family doctors, what is their history, and in a couple of hours he has come up with the number of diagnoses. So he was based in, well, the X-ray doctor, yeah, not the family doctor, and the team was working in the Pariatan district. So again, can the X-ray machines, X-ray devices be added for the family doctors? Well, now as a medical health units, we can make a screening examination of the patient's mammography, their liver, stomach, cardiovascular system, digital cardiography. We can do all of it. But today we need the digital X-ray devices, which are not so expensive, about 1.5 million hryvnia each, and we should start pondering over buying them, whether we should buy some costly equipment for the centers, or we should cover the needs of the people in this type of equipment. And us as the Red Cross Society, we have our logistics, we have our teams. The specialists can be trained, I mean the operators of the devices, and then the doctors will not have to go there. The doctors may be based in Poltava, Kyiv, Mukachevo, elsewhere, and they can decipher everything. So implementation of digitalization, telemedicine is urgent for Ukraine as never today. Exactly, because people have limited access to doctors, to healthcare services, and you know why. Thank you, Mr. Mykola. Let's give an opportunity for the journalists to ask their questions. Good afternoon, Anastasia Rakuta, Ukrinform. Can you summarize what are the technologies used for the primary link of the medical teams and what are the results achieved using the digital technologies with the primary link in Ukraine? Well, I would like to say that this is a pilot project we're having, and this pilot project is being implemented for the time being in Poltava region. We are about to spread it to Dnipropetrovsk region, to Zakarpattia region, where it's possible. But what I would like to say is the main task will be identification of non-infection diseases. In the structure of the mortality of population, cardiovascular diseases account for 66% and non-infection diseases in the structure of mortality account for 94% of deaths. This is why we cannot cover all of Ukraine, but we try to provide our support where today the local governments identify the need for that. We work with the community governments. We have the structure of reporting and analysis with a breakdown to residents, to the internally displaced persons, because internally displaced persons are not the only category we service. So we identify the pathology and we link the patients to the specialists or to additional examination, plus we issue the free medicines. Thank you very much. So let's wrap up here. I want to thank our guests. Well, I apologize, but we have an hour. Maybe someone else wants to ask something. Well, we seem not to have any more questions from the floor, but if you have anything to add, you're welcome to do so. Good afternoon. Vyacheslav Redko, representative of Latvia Red Cross in Ukraine. Thank you very much for this useful thing you're doing. Today, the population of Ukraine has their diagnostic culture on a very low level. It should be explained in more detail to the people. So my question is as follows. Telemedicine, that is something that will be widespread in the future. Can people based abroad use this type of service? Thank you. Thank you. What I can tell you that people who are staying abroad and who can use the telecommunication means, they can address the doctors using telemedicine, either those assigned to the centers where they are located. So today there are no limitations in this sense. Well, I'm a neurosurgeon, and as soon as the computer tomographs and the telephones have emerged where you can see what's going on the screen, so I was providing advice to my patients online. I was offering it as a neurosurgeon, like send me the results of your tests and I will tell you what to do. So yes, right, this is the future. And sometimes the people, they have some mistrust in new technologies. We were in Piraten, and they were asking us, so okay, so what's going on there? There are skeptics in the society, like, show us the passport, show us the documents, who you are. But when they've seen us deploy our diagnostic team, who were doing their business, they were coming from their villages and they were asking us to come there to their village. So the culture of the people today is affected, in terms of diagnostics. I don't claim to have a license. We take the specialists and we ask the specialists who examine, who provide comprehensive information on the results of the tests. We report, we show what we're doing. Thank you. And if we have no more questions on the floor, but you have anything to add, well, maybe my colleagues have something to add. Well, I would like to say, dear colleagues, today the Red Cross Society has people of different professions working with them. You know, we don't have many medical specialists, but we have people who know what's logistics, who know what's management, who know how the processes are going on. My colleagues, they are not professional medics, but they are incredibly professional, and they master the knowledge that is necessary for the people. They come to work with the Red Cross, they come as volunteers, and we have more than 8,000 volunteers. Well, and among them there are people who are specialists in their areas, and they see how their skills can be used for the people. We are a humanitarian organization. We are the biggest humanitarian organization in Ukraine. We help people, we help the government in overcoming the humanitarian crisis, in mitigating its consequences. Obviously, everything is not so smooth. Sometimes there are some shortcomings, but we correct the mistakes, and I want to say we are always ready to help the people. Thank you. Thank you. We want to thank our guests. I'm reminding you we were talking about the operation of the mobile health units of Ukrainian Red Cross in Ukraine, and Ukraine Media Center will continue its operation tomorrow.